As soon as I stumbled across high impact medicine, I thought, oh my gosh, this is the niche of where medical doctors meets wanting a high impact career, but tailored specifically for medical professionals. So I thought that was really perfect. Hello, I'm Bo. I'm based in Brisbane, Queensland, Australia, and I am a fully qualified GP. So I started my medical journey in Brisbane. I went to medical school in Brisbane and then shortly after that decided to train to become a rural generalist. So that involved doing 3 years of hospital training, and then I went into rural communities to train in general practice. And I've really loved my rural work ever since, so that's where I'm predominantly based. During my training, I also had this wonderful opportunity of doing an academic post, which involved a part-time job in the university doing some lecturing as well as doing some medical research. I found that very rewarding, and it was lovely to complement my clinical work with that. Since I've become a fully fledged GP, I've decided then to also split my time to do different types of medical work. Now I travel a lot over the country and I work predominantly in rural Indigenous communities, and I find that very rewarding, but also quite challenging. I've decided to also mix that with working from home as a GP educator. I do some external assessments for the college, for the GP trainees. As for how I found high impact medicine, in the last few years of practicing medicine, what I've really noticed is that despite it feeling very rewarding to help people, obviously one-on-one in the clinic room, I did start to feel that perhaps I could have higher impact in my career other than just being a one-on-one clinician on the ground. I began to feel like I wanted to pursue something more at the systems level. And so that led me to do a lot of soul searching and a lot of reflecting. One of the resources that I came upon was 80,000 hours. And so I read the career guide, which was quite mind blowing. I think especially the example that they used for medicine and for doctors is what really confirmed what I had been suspecting all along. Then I decided to go down that rabbit hole and explored effective altruism and came upon high impact medicine. As soon as I stumbled across high impact medicine, I thought, oh my gosh, this is the niche of where medical doctors meets wanting a high impact career, but tailored specifically for medical professionals. So I thought that was really perfect. They reached out and had a chat first with Louisa, which was very helpful. And she very quickly recommended that I do the career planning fellowship. I signed up as soon as I could, and I guess I'll talk a bit about what I'd hoped to achieve through joining the course. And of course, ideally, I thought, wow, maybe I'll find my dream career out of this course and it will give me this one simple answer for what I should do with my life and my career to have the most impact. Wouldn't that be nice? But of course, I also realistically didn't think that that would be the case. And in the end, I think what it has helped me to find is lots of possibilities and open the door to lots of new avenues that I had never considered through tools that I had never learned to use. So I found that very rewarding. One of the things that I found the most useful was the weighted factor model that we used. And what that allowed me to do is really engage in this kind of blue sky thinking about all these possible careers that I had either written off or never seriously considered because of one or two reasons. But here was a tool where I could really sit down and consider them at length and through lots of different lenses in lots of different dimensions. And in the end, compare and contrast through data, which obviously as scientists, we all love to do some, solid objective evidence in front of us as to what works best. What it's kind of ultimately led me to find is a reflection of what I've already been doing, which is this portfolio career, which I've been slowly building for myself. And I still firmly believe that that's what I will continue to pursue, and it's what suits me the best in my career. But I guess it's just opened up a lot of extra options for me to add into that portfolio. One of the final things that came out of this was actually my blog that I'm now writing, which I think you've read one of the posts for. And that was one of the promises that I made. I can't quite remember which week it was where we had to set kind of a task to say, by this time, I'm going to do this, and just break it down into very small, simple steps. And so I chose to launch the blog towards the end of the career planning course because I thought, here is a really tangible and achievable thing. It felt like a smart goal to have it be achievable by the end of the course. And I'm really proud that I pushed myself to do that. And I'm really grateful to High Impact Medicine for providing that opportunity to push me to do that. Because I guess one of the career options that I investigated and thought could be quite suitable as part of my portfolio career through this career planning course was a science communicator role. And I've always wanted to engage a bit more in the science communication space. I have this course to thank for really finally nudging me in that direction, something that I've wanted to do for a long time. And as a little side note, out of that, it's pushed me to actually recently attend a science communication workshop. And I just so thoroughly enjoyed that. And out of that has become a project to write another article for publication. I've really felt like that's been a tangible thing that's come out of this course. The other thing that it's really helped me to solidify is that I actually, shortly before the course started, signed up for a double master's, and I'm doing a Master of Public Health and Health Leadership and Management. And as I was looking into that course and signing up for the course, I had a lot of doubts and a lot of worries about, is this the right path to take? Is this going to be high impact? What if I make the wrong decision? I really factored that into the course and all the decision-making tools, and ultimately decided that it would be a really good idea for me. And as part of that explore, exploit model that we talked about, this felt like a really wonderful way to explore at a time in my career where I could afford to do that while still exploiting with the other parts of my career, like my clinical work. It gave me a clearer perspective on how I could balance those things. In regards to the group that I was a part of, we were quite a diverse group. So I guess I was from Australia. One of the other participants was from Switzerland. Moses, of course, was from Nigeria. Immediately there, we had three very different perspectives on health, and there were other participants who joined too who were from other countries as well. That made for very interesting discussions, and I almost wish we had more time to just talk about our different health systems. But of course, that's not the main aim of the course. But that did add an extra layer of interest and understanding, and also of camaraderie in a way that you think, oh, wow, there are people all over the world who are feeling the way that I'm feeling or seeking the answers that I'm seeking. That's a really lovely community to belong to, especially for me working in rural health. It can be quite isolating, and often just as a GP, it can be quite isolating because you're working just in one room by yourself. I don't have too many people in my circle who are very interested in pursuing a high impact career or necessarily just discussing these philosophies that we talk about. So to be able to have that dedicated time every week to meet with like-minded people to really just go through this was really wonderful. Actually, one of the things I found most useful about it was just that it was a regimented and structured time frame with set tasks each week. And I guess I work very well to deadlines. I felt compelled to do the readings and do the exercises and the activities to be able to get the most out of it during the meetings. To someone who has just come across high impact medicine and isn't sure whether they want to engage, I say just go for it. There's very little to lose. I think that's what was so wonderful about engaging, is that the barrier to entry was so low, and I found everyone was so easily accessible and so friendly. And so I was able to line up this chat immediately with Louisa, and she made herself so available. It was just nice to know that she was just another human being on the end of the line, even though she was halfway across the world. But we had a lot in common and striving towards lots of the same things. It gave me the confidence then to join the course and realize that that would be a good thing to do. Once I did, what I also found really wonderful in the course is that I guess compared to some of my fellow course participants, maybe I am a little bit further along in my training and career path, hopefully quite useful to them. And I know certainly for one of the medical students in the group, he was really fascinated to hear a perspective of a clinician who had already finished training and had already tried a lot of different career paths. And so we actually ended up having a one-on-one chat individually so that he could ask me more questions outside of the course. I was really happy to do that for him. And of course, being in contact with someone who's really early in their career path helped me as well, because it's a very fresh perspective, I think, when you're a medical student compared to when you're 10 years, finished training and you've been out working clinically for a long time and perhaps a little bit disillusioned with the system. So I found that those very different perspectives, we really helped each other to hopefully he I think gave me a lot of fresh perspectives and a lot of idealism maybe that I had lost or I wasn't exploring anymore. And I gave him a lot of real world experience and maybe guidance in what I had already tried and encouragement too. Because he too, I think, was quite doubtful about trying lots of different things. He did say, I think it's so wonderful that you've managed to sample so many different things in your career and during your training. And I didn't know you could do that. One example was the research. He said, I always thought that I would have to commit to a career in research if I did it. And I didn't know that you could try and find these programs that just allowed you to do it for 1 year and gain some skills. And so I think that was very valuable too. In short, I think have a good read through the website and just connect. And even if you kind of just, lurk in the background a little bit as just a community member to keep an eye on the newsletters and the podcasts, I think it's really worthwhile. And you might find that one day you find something that inspires you to take that next step. I think that never hurts. I guess I guess to lead on from that point that I was making with this fellow participant where I really enjoyed already doing a bit of mentorship with him. Yes, that is something that really appeals to me because I have always been very passionate about education, the lecturing that I've done at the university and now the education that I do with the GP trainees. I really love that, providing guidance to the next generation of medical students and doctors and whatever else that they choose to become, I think is something that I find extremely rewarding and also very humbling. I think it keeps me very honest. I'm forever learning things from my students. And it forces me also to keep up to date with the latest guidelines, latest knowledge, the latest news. It helps to keep that idealism, like I mentioned before. I've keeps you young, I guess. I would actually be quite interested in either mentoring or facilitating.